Greetings, everyone. We, the Team 27, are here to present our solution as a part of Diabetic and Next Hackathon Phase 2. So, here we will discuss about the situation and background of diabetic foot disease in India. India has over 101 million diabetics and it is ranking second in worldwide. The diabetic foot disease treatment are also 4 times higher, and 1 in 4 diabetics in India are prone to develop a foot ulcer. Therefore, it becomes important to discuss about the existing solutions of diabetic foot disease and a gap in the solutions that is paving way for more and more number of diabetic foot disease in India. So, what are the gaps that we face in diabetic foot disease? If you look at that, the India's diabetic foot care challenge is medical, structural, and behavioral, and technological as well. So there are short consultations, late diagnosis, awareness barriers, footwear challenges, costly screening, and rural access issues, which makes it important for us students to come up with the novel solutions for the same. So our concept map for the same includes problem identification. We identified the problems in the previous slide. Our solution is basically an AI-powered screening tool along with short video for foot examination to educate the clinicians and the patients, image-based patient education material to overcome the linguistic barriers of this country, and doctor-patient portal so that the patient can interact in a safe environment without having to face any psychosocial stigma. We did face some challenges during this process, debugging and API integration for developing this app. Also finding relevant content for the examination, investigations, and material for the video was difficult. We did overcome through the following methods. We made a 60-second examination video, a quick video using VDA. The literature review was done for the significant associate factors, and we came up with an app with Python 3 Flask-based platform for app development. Future plans is to scale this to a bigger level, especially to implement it in the PHC level and to overcome the inter-user variation due to the cameras of various smartphones. So the literature review that we did show some of the strongest association factors with reference to diabetic foot disease. One among them was triglyceride glucose index, and how it actually increases the severity of diabetic foot ulcers and type 2 diabetes. This is one of the papers that stated that patients with high total cholesterol, LDL cholesterol, and HDL cholesterol had a risk of developing diabetic foot ulcers, and the severity of the diabetic foot ulcer in those patients increased with increased levels of cholesterol. Also, vascular calcification is an important factor in diabetic foot. Patients with altered calcium homeostasis, they had worsening of diabetic foot ulcers, is what this paper had to say. And diabetic retinopathy is also one of the important tools by which we can find the incidence of foot ulcers in diabetic patients, and we did some research on that paper as well. Also, one of the shocking revelations that we came across when we did our study was that the awareness and practice scores among the patients with diabetic foot disease who are taking foot care was actually low in India, especially according to the study. There are about only 41.6% of the participants were practicing good foot care, and only around 70% of the patients had good awareness about the same. So we did come up with a visual poster to encourage patients to have a proper diabetic foot care routine. To overcome the linguistic barriers, we made it minimalistic, and we did include a lot of pictures as well. What happens when healers overlook the feet? Of course, the treatment becomes slower, and as we see, around 58% of the physicians reported that providing the proper preventive and therapeutic care was difficult for them. Only around 26% of the physicians did around callus removal and changing the dressings in patients with diabetic foot disease and ulcers. So we did come up with the examination video how to assess the diabetic foot disease, and this video will be available along with our project. So coming to the technical feasibility of our project, this is an overview of the app development. We defined proper user roles, and the application, as we told earlier, is a Flask-based web platform. It was built using Python 3. The data management system was with Flask SQL Alchemy, and the migrations were planned to be smoother, and we integrated Flask Migrate for that. Step 3 was to include the core features and the image-based AI diagnosis. As we are speaking, the observations were made using and diagnosed, like the observations by AI was using Google Gemini Vision API, and there was also a real-time chat system implemented for the patient chat room, and it was using Flask Socket IO. The deployment strategy was taken care by the render.com. What are the technology stack that we included? As we told, the backend was Python 3 Flask, front-end included Jinja 2 templating, Bootstrap and Flask WTF. The database was SQLite, PostgreSQL, and Flask Migrate for seamless schema updates. Role-based architecture, as we told, patients have their own roles to upload images, view reports, and real-time chat for the patients. Doctors review cases, annotate findings, and chat with patients again. There are also roles for admins to manage the users and to have a regulation over the system settings, and authentication was based on role-based access control, as we told. The AI integration was helpful because the image-based observations, whatever the image the patient is uploading, it was analyzed by AI, and the Google Gemini Vision API detects the ulcers, callus, corns, and scaling between the toes, bunions, and all the deformities that the patient had, or even an erythema or signs of infection. It analyzes, interprets, and displays its insights so that the clinician is also alerted on the same thing, and the patient is also alerted whether he or she should go and meet the clinician immediately. So how is the clinical feasibility of a project? If we talk about the cost analysis of the same, we came up with a rough cost analysis for the thing. So the app development, all along with the annual maintenance, backend maintenance, the API subscription, along with the visual aids, training, outreach, and other things in our project came around 70 lakhs. So the deployment cost for this project is around 70 lakhs. If you look at the cost per patient for the initial rollout, even if we are planning to reach 1% of the diabetic population, according to World Diabetes Day publication in 2024, it says that India has around 212 million diabetics in the year of 2024, around November. To reach around 1% of this population, which is around 21 lakhs of the people, the total cost being 70 lakhs, cost per patient comes around 3.34 rupees. So considering this, it is actually scalable and useful. So the future scaling of this project, of course, the per patient cost will decrease as the project scales. Additionally, the operational cost, which includes the API and maintenance, will be distributed across more users as users join in. We have public-private partnerships, especially we are planning to get some NGO and government support, which can also subsidize some of the costs, especially for the patients in rural areas who have very low access to technology. So the stakeholders for this project and what are our strategic buy-in for them, we have discussed about that, and we have come up with a summarized table. We have different stakeholders, as you can see. We have patients, doctors, public health authorities, investors, and NGOs are offering for the patients is AI tool, chat room, visual guides without having to face any social interaction or any stigma that they have to show their particular ulcer or the deformity of the food to a physician or anyone else. Doctors, again, it's actually easy to monitor them. They can do an entry for the patient wherever they are. It is easy to triage. There's a smart triaging system. It is an e-dashboard so that they can see the number of patients with the particular conditions, and the AI will also alert them. Public health authorities, it is actually important to reduce the cost for them. So this plan is actually scalable as there are a lot of patients for them, and the uh, user load is actually very high. Actually, investors, they will be highly interested because it is a scalable innovation and there is high return of investment. NGOs and ASHAs are an important part of the stakeholder part because they are actually crucial to improve this particular model in the grassroots level. Hospitals and clinics, they need to reduce the readmissions for the diabetic foot disease. So we are actually offering them a prevention-focused screening because this tool can not only screen the diabetic foot ulcer patients, but also patients with the risk of diabetic foot disease with infections, erythema, or any pre-diabetic foot ulcer condition, which the AA can actually screen and provide a diagnosis or a plan with. So the projected impact for our project is the metrics that we consider include the diabetic foot ulcer incidence, amputations, and other things. So we hope that with our solution, the diabetic foot ulcer incidence will decrease around less than 15% the proactive screening tool that we have come up with. Cost for patients, again, it is actually going to reduce a lot of cost. The screening coverage is going to be high because we are using only mobile and visual tools, which will increase around, like, current screening rate is around 20%, less than 20%. It might increase around 70% is what we are aiming for. The patient adherence is going to increase because the patient has an autonomy to do a self entry, and there is also community engagement with other diabetic foot disease patients coming in. So it is going to be easier for them, and the adherence rate is going to go high. So we would like to sincerely thank the Department of Endocrinology, CMC Vellore, and our diabetic nurse educators, Ms. Bharati, Mrs. Sunita, Mrs. Ruth Valina, for their contributions with the data sets that was used to train our AI. We hope that this was a useful presentation. We have also attached the artificial intelligence powered screening tool and our app link in our project. So kindly check it out. Also, at this moment, I would like to thank our teammates, especially Mr. Mahandeep Parida from IIT Madras, who's been a sincere teammate who has been working with this app, and also Mr. Gopal Krishna Mishra and Ms. Nisha, and myself, Manuel Inbam, signing off. Thank you all for listening. We hope this was a wonderful presentation which can be implemented in the near future. Thanks again.